women's mental and emotional health. तो just looking at the topic, I think आप लोगों को एक थोड़ा बहुत idea आ गया होगा कि how this session is going to be. So in this session, basically we'll see what exactly are the hormones which are present in female's body and how they will have impact on your thinking, how they'll have impact on your behavior, how they'll have impact on your day-to-day life, and how overall how they'll have impact on your body. Okay, and हम थोड़ा एक स्टेप आगे जाके वी लर्न अबाउट कोपिंग स्ट्रैटेजीज, हाउ टू ओवरकम और हाउ टू प्रिवेंट worsening of those emotional and mental stress. Okay, so in the past, अगर आप पिछले 10-15 साल का रिसर्च देखेंगे तो you will understand how the view of researchers have changed. That is, initially there was a very standard way of doing research, but in past 10 to 15 years, people have started coming up with body, mind and your surrounding. That is, हम जिस environment में रहते हैं, हम जो सोच रखते हैं उस specific environment में, that has a very big impact on our body as well as our overall well-being या फिर overall mental health जिसे हम कहते हैं. So basically, if you see the research background in terms of women's health, there was a very, I would say that there was scarcity of literature which commented on women's health. Okay, और उसके बाद आगे जाके women's mental health, ये टॉपिक्स पर बहुत कम डिस्कशन हुआ था या फिर बहुत कम रिसर्च हुआ है अभी तक. बट in past 5 years या फिर post COVID, if we go through the literature or if we go through the data, we'll come across lots and lots of research which states about women's mental health, women's emotions and everything. Okay, so in this specific session we'll see how hormones have impact on a woman. Now when we talk about hormones, hormones are nothing but दे आर एंजाइम्स जो हमारे बॉडी में ऑलरेडी प्रेजेंट होते हैं. ओके, और उनका एक नॉर्मल रेशियो होता है हर एक हार्मोन का. तो अगर वो हार्मोन उस रेशियो से कम या फिर ज्यादा बॉडी में होता है, देन दैट कैन हैव ए इम्पैक्ट ऑन आवर ओवरऑल वेलबींग. Okay, so we'll first see what are the hormones, then we'll talk about few clinical conditions and then the coping strategies for that. Okay, so initially when the child is born या फिर when a baby is born, the hormones or the hormonal surge का मतलब क्या होता है? हॉर्मोन्स का बढ़ना या फिर कम होना. ओके, अगर हार्मोन एक स्पेसिफिक रेंज से ज्यादा बढ़ रहा है तो उसे हम हार्मोनल सर्ज कहते हैं. सो जब एक बच्चा बड़ा होता है तब उसके बॉडी के जो हॉर्मोन्स है वो एक स्पेसिफिक लेवल तक होते हैं. बट जैसे जैसे प्यूबर्टी आती है, प्यूबर्टी इन द सेंस व्हेन द चाइल्ड अंडरगोज ए टीनेज group, that is when the child or when the girl undergoes her first menarche, that is her first menstrual cycle, or when a boy undergoes his featural changes, reproductive featural changes, उसे हम प्यूबर्टी कहते हैं. तब हॉर्मोन्स का अचानक बढ़ जाना या फिर कम होना ये बहुत कॉमन चीज है. उसके साथ साथ हॉर्मोन्स के साथ साथ हमारा बिहेवियर या फिर हमारा जो साइकोलॉजिकल मूड चेंज है वो भी चेंज होता है. सो इफ वी लुक एट ए वुमेन्स लाइफ, द फर्स्ट स्टेज दैट इज व्हेन शी starts developing her reproductive features, that is when her breast tissue enlarges, she starts going into feminine features, her voice gets more softer, more deeper. That is when she attains her lethargy, that is when her physiological hormonal changes occur in the body. So that is called as lethargy. Okay, that is called as lethargy. And when she gets her first menstrual cycle, उसे हम मेनार्के कहते हैं. Okay, and then she undergoes regular menstruation throughout her life, and by the age she reaches 40-45, her menstrual cycle stops. That is called as menopause. Okay, so ये जो चारों स्टेप आप देख रहे हैं, all these 4 steps takes place under the influence of a substance called as hormone. Okay, without hormone these things cannot occur in a female's body. Fine. So you imagine, आप सोचिए, the female undergoes through so much of tremendous change and tremendous hormonal surges in her body. So you can imagine कितना drastic change होता है regulation of mood or emotion में भी. So we'll see that in the coming time. Fine. So here, this is just a overview of how actually hormones are produced in a female body. So the first thing is hypothalamus. Now, hypothalamus is a very small organ inside our brain. So, a few years ago, I was asked about what exactly, according to you, is a menstrual cycle. So, I had abruptly stated that menstrual cycle is nothing but just a coordination of movement happening between your brain and the ovaries. So the person who actually heard my answer just laughed out, because that was not exactly the clinical answer which he or she expected. But when I gave this justification, that was when what I stated was right. Hypothalamus is nothing but it is a small organ in our brain. So hypothalamus इज मतलब आप कह सकते हैं कि वो एक कमांडिंग सेंटर होता है जो बॉडी को कमांड देता है कि आपको हार्मोन रिलीज करना है. ओके, सो दैट इज द कमांड सेंटर. सो हाइपोथैलेमस stimulates this is GnRH is nothing but it is another hormone which triggers pituitary to stimulate the ovaries. तो ovaries का बेसिक काम होता है कि वो ईस्ट्रोजन और प्रोजेस्टेरॉन प्रोड्यूस करे. अभी ईस्ट्रोजन और प्रोजेस्टेरॉन आपको थ्रू आउट लाइफ आपको याद रखना है, बिकॉज ये 2 ही हार्मोन है जो फीमेल बॉडी को मॉड्यूलेट करते हैं थ्रू आउट. ठीक है, सो ओवरीज विल प्रोड्यूस ईस्ट्रोजन, प्रोजेस्टेरॉन, एंड बोथ दिस टुगेदर विल एक्ट ऑन आवर यूट्रस. How we'll see that. Okay, so these are the overview of the hormones which are present in a female body. So first is the estrogen, जो हमने अभी देखा, which is produced by the ovaries. Next is the progesterone, which is again produced by the ovaries. Okay, LH and FSH is produced by our pituitary. Fine. एंड यहाँ जो आप देख रहे हैं टेस्टोस्टेरॉन, अभी बहुत लोग ये भी कहेंगे कि टेस्टोस्टेरॉन इज रिलेटेड टू मेल्स. ओके, इट इज कॉल्ड एज मेल हार्मोन. Yes, it is called as male hormone because it is present predominantly in males. जैसे females में progesterone होता है, वैसे males में testosterone होता है. But testosterone is also produced in small amount in female body. Okay, and it also has small, very minute functions in female body. Fine. So we cannot exclude testosterone completely from a female's body. Next is serotonin and dopamine. I'll tell you the mechanism of these two later. And this thing is a very remarkable hormone. Why? Because it is called as a stress hormone. Okay, जब भी आपको स्ट्रेस होता है तब आपके ब्लड में, आपके सलाइवा में कॉर्टिसोल का जो प्रमाण होता है वो बहुत ज्यादा होता है. दैट इज व्हाई इट इज कॉल्ड एज ए स्ट्रेस हार्मोन. ओके, now we'll slowly we'll see how the each hormone influences a female body. So सबसे पहला और सबसे important है estrogen. Okay, now estrogen is also called as a mood modulator. Now why it is called as a mood modulator? Because if estrogen is not present in female body, then आपको adverse symptoms दिखते हैं in terms of a female's overall psychological well-being. Okay, so estrogen jab it is produced by the ovaries, it goes to the uterus where it acts in the function of the menstrual cycle. Along with that, in the overall mind or overall brain structure, it also influences very important hormone, that is serotonin. अभी आप अगर serotonin देखेंगे तो serotonin is called as a very happy hormone. Okay, now why it is called as a happy hormone? जब भी serotonin normal level में होता है in human body, it will keep you happy, it will keep you engaged, it will, you know, it will always give you pleasure, it will always keep you motivated. ठीक है. So whenever serotonin acts on your brain, it acts in all these categories. That is, it will keep you happy, it will keep you calm, it will keep you motivated. Fine. So that is why we call it as happy hormone. Now estrogen will have direct effect on your serotonin. Okay. So estrogen और serotonin एक साथ काम करते हैं. तो अगर estrogen बढ़ेगा तो even serotonin also increases. If estrogen falls down, then even serotonin falls down. Okay, so the need to maintain a normal level of estrogen is very important, so that the female or the woman is always happy or is always in a good mental state. Fine. So that is function of estrogen. So if you have a low estrogen, फाइन, अगर ईस्ट्रोजन का लेवल आपकी बॉडी में कम होता है तो आपके बहुत सारे ऑर्गन्स पर उसका असर दिखता है. ओके, सो द फर्स्ट थिंग विल टॉक अबाउट माइंड, ब्रेन, विल टॉक अबाउट सीएनएस. सो द फीमेल विल ऑलवेज हैव हेडेक्स. ओके, ब्रेन फॉग. नाउ व्हाट इज ब्रेन फॉग? ब्रेन फॉग इज वेयर आप ब्लैंक हो जाते हो, यू कैन नॉट प्रोसेस थिंग्स. ओके, योर थिंकिंग ability or your capacity to justify or your capacity to you know to understand something in a very deep way, you will not understand that. That is called as brain fog. Okay, next is forgetfulness, that is bhul jana. So all these things will be prominent if there is low estrogen. Fine. Next is poor concentration, that is the female or the woman will not be able to focus, maintain her focus. There will be extreme mood swings, that is she is going to show you extreme signs, that is either she is going to be too angry on you or she is going to be very low. She'll not react anything on whatever you say or do. Okay, next is anxiety and depression, which comes along all the hormones which are present in female body. Okay, now next comes to the urinary system. Okay, so urinary system means the system which actually helps you in doing micturition. Fine. So the first thing is hot flashes. Now what is hot flashes? Most of you, बहुत आप में से काफी लोगों ने experience किया होगा. If there is too hot temperature or basically during summers, when you go to pass your urine, the urine will be very hot. Okay, and the entire area around your vagina will be very warm. Compared to normal days, it will be very warm, or sometimes it will be very hot, and there will be sweating throughout at that specific area. So all these are the signs and symptoms of hot flashes. Okay, again that is not a good thing for the body. Next is night sweats, रात को बहुत ज़्यादा टेम्परेचर बढ़ना और पसीना आना, that is one thing. And next is urinary incontinence. Urinary incontinence एक बहुत last end stage कहा जाता है, where the estrogen falls down, because estrogen का और एक काम होता है कि वो आपके मसल्स को कैल्शियम प्रोवाइड करता है. Okay, it provides calcium to your muscle. So if it is not able to provide calcium to your muscle, then what will happen to the muscle? The muscle will undergo weakness. Okay, so because of that, your muscles of the urinary bladder, या bladder जो यूरिन हमारी स्टोर करता है, वो वीकनेस में जाने के बाद जो यूरिन का जो होल्ड होता है, that hold will be lost. So your urine will start leaking from the bladder. That is called as a state of incontinence, where the bladder is not able to control the urine and there is continuous leakage of urine. Okay, so that is last stage. Next is vaginal dryness, that is too dryness of the skin or at the vaginal area. बहुत ड्राई होने के बाद you even tend to have itching. Okay, you even tend to, and there is the itching is so severe कि we have patients who have abrasions or who have wound at the specific tissue of the vagina. So that is again a very wrong thing. Next is painful intercourse and recurring bladder UTIs. UTIs is nothing but urinary tract infection, which will be very common. Why? क्योंकि सबसे पहले चीज क्या हो रही है, वजाइनल ड्राइनेस हो रही है. सो वजाइनल ड्राइनेस कब होती है, जब आपके वजाइना का स्पेसिफिक एक बैक्टीरियल जोन होता है. ओके, जिसे हम गुड बैक्टीरिया कहते हैं, जो आपके वजाइना का इट गार्ड्स योर वजाइना. ओके, ideally there will be entry of, it is very easy for any kind of external bacteria to enter the vagina because of its vaginal opening. Okay, but since there is presence of already a good flora and fauna present in the vagina, they maintain the pH, that is pH मतलब जो entire tissue है उसका एक acid level होता है, तो वो maintain करते हैं. Plus they also maintain the moisture of the muscle, plus they also maintain the overall hygiene of the area, vaginal area. But because of dryness, because of too much hormonal surge, what happens to the bacteria? The bacteria dies. Okay, the good bacteria dies. So because of that, your vagina is susceptible to lots and lots of infections throughout the daily routine. Okay, nowadays females they work a lot, they work for day and night, then they have poor sleep, they have poor hygiene, they do not maintain hygiene. They go in morning, then they come at night throughout, and then they are tired and then they sleep. Okay, so there is no proper maintenance of hygiene. Even during menses, they do not maintain proper hygiene. The pads are not changed regularly because of their extreme work pressures. So all these conditions will give rise to very frequent UTIs, vaginal dryness, and all those things. Okay, so maintaining hygiene is also one more thing if there is hormonal issue. Next comes physical features. Okay, so in physical features there will be thinning of hairs. सबसे पहले चीज होगी hair loss. Okay, then along with hair loss, the girth of the hairs is going to reduce. Okay, so because of that, बाल काफी ज्यादा पतले हो जाते हैं, and you can actually visualize the scalp. Fine. Next is facial hair lethargy. Now, facial hair is another condition which I'll be talking next. Facial hair is where normally there are very fine and very small hair particles or hair structures on the face, and it is very normal. Okay, but when those hair structures, they start thickening or they start becoming dark, they start becoming long, that is when it reflects the hormonal change. That is where the hormones have influence on the hair structures and they start growing abnormally. Okay, so that is facial hair. And next is lethargy. Lethargy means बहुत easily tired होना, बहुत easily थक जाना. That is called as lethargy. Next is the skin is dry, then there is increase in weight, and there is joint pain. Okay, so all these things will happen if there is low estrogen. Fine. Now this is where the estrogen is high. That is estrogen normal level से जब बढ़ जाता है तब क्या क्या चीजें हो सकती है. ओके, तो सबसे पहले चीज होगी दैट ईस्ट्रोजन. अभी बाय नाउ आपको पता चल गया होगा कि ईस्ट्रोजन हैज इफेक्ट ऑन आवर यूट्रस. ओके, so since it has effect on our uterus, what is the function of uterus? It carries our menstrual cycle. Okay, that is, it carries our menses. It functions for our regular periods. Okay, so when estrogen is high, it is going to affect the uterus. Okay, and uterus is going to create trouble with our periods. That is, the menstrual cycle is not going to be regular. Okay, अगर irregular होने के बाद एक आध बार, like we have females who come with irregular menstrual cycle, and the menstrual cycle is absent for almost 4 to 5 months. Okay, 4 to 5 months तक पीरियड्स नहीं आते हैं, एंड उसके बाद जब पीरियड्स आते हैं तो वो बहुत हेवी होते हैं. द ब्लीडिंग इज वेरी हेवी, देयर इज क्लॉटिंग, देयर इज पेन. ओके, प्लस those menses are very short, 3-4, within 2 to 3 days or within 3 to 4 days the menses go away. So all these are signs of high estrogen levels in the body. Okay, plus when estrogen increases, the weight starts increasing. Why? Because estrogen will start acting in terms of metabolism. Metabolism is आप जो खाना खाते हैं वो कैसे डाइजेस्ट होता है, कितना डाइजेस्ट होता है और कब डाइजेस्ट होता है, that is called as metabolism. So if you're eating, let's say around if you're eating around 4000 calories per day, when estrogen is high, the body will not be able to digest those 4000 calories. अगर आपका estrogen normal है तो आपका body फिर भी कुछ कैलोरीज बर्न करके, कुछ कैलोरीज डाइजेस्ट करके आपका वेट मेंटेन रहेगा. बट व्हेन द एस्ट्रोजन इज हाई, दैट burning of calories or that burning of cholesterol does not happen. So because of that, there is increase in weight. Okay, so when the weight increases, the girth of your thighs, your hands, your stomach, your chest tissue, everything goes on increasing. Okay, so that is the effect of too much estrogen in the body. Okay, next is there is decreased libido. Decreased libido is nothing but the sexual intimacy, the feeling of sexual intimacy goes down. Okay, so that is where the sexual life is compromised. Next is mood swings. So एक चीज आपको याद रखनी है कि आप कोई भी हार्मोन ले लो, any hormone in female body, you will see all these features. Okay, anxiety, irritation, then anger, डिप्रेशन, ये सारी चीजें हर एक हार्मोन के साथ आती है. ओके, बट द वे यू प्रोसेस इट और द वे यू मॉड्यूलेट द इमोशंस, दैट इज द मेन टॉपिक ऑफ डिस्कशन. ओके, फाइन. Along with mood swings, then there is blotting. Now what is blotting? Blotting is nothing but when there is too much of accumulation of water inside the body, or there is too much accumulation of undigested food in the body. That is called as blotting. Initially, I don't know how many of you experience it. Before your menses start or before your periods come, a week prior, you'll always feel bloated. Okay, your stomach will be little inflated, and you'll feel little heavier from your lower body. Okay, you'll even few females, they also have swelling because of too much of water in the body. So that is blotting. That is normal. Okay, लेकिन जब वो frequently होता है, when it happens every now and then, that time it is not good. So that is a sign of high estrogen in the body. Okay, headache we saw, because headache because estrogen will also have effect on your brain functions, so that is why there will be headache. Okay, hot flashes will be there. PMS, what is PMS? I'll tell you in the coming slides. Okay, now next is breast lumps. Okay, these lumps are not cancerous, but these lumps are related to your fibrin of the muscle. Ideally, breast are nothing but they are soft tissues. Okay, or you can call it as soft muscles. Okay, so when there is dysfunction of those muscles, or when there is dysfunction of those tissues, the ducts present, or the milk ducts which are present in the breast, they will start swelling up. Okay, so that is when there will be breast lumps. Okay, brain fog, I explained you earlier. Okay, fertility problems will be there, but infertility tab aayegi when the periods are irregular. Okay, if the periods regularize, fertility issues will be resolved, but since there are irregular periods in high estrogen, there will be fertility issues. Okay, then excessive hair fall, fatigue will be there, and thyroid dysfunction. Okay, thyroid dysfunction we'll discuss in the coming slide. Next hormone, very important hormone, that is progesterone. Okay, now progesterone is a very what you can say, very lazy hormone. It is called as lazy hormone. Why? Because it is always going to keep you calm and quiet. Okay, and if it is increased in the body, the person is always going to feel sleepy. Okay, so that is why, like, if you see here, there is one moon present here in this image. Okay, so that denotes that the person is always going to be lazy and always going to be sleepy in women who are pregnant. Okay, now this is also called as pregnancy hormone. Okay, remember P, progesterone, and P, pregnancy. Okay, so in females, during pregnancy, even they tend to sleep a lot. Okay, their sleeping duration increases, their resting period increases, and they are always tired, so they always want to take rest. So that is because of progesterone. So if progesterone is present, the pregnancy is maintained. If progesterone falls down, or if there is any issue with low levels of progesterone during pregnancy, the pregnancy gets terminated. Okay, so progesterone is again a lazy hormone. Now why it is called as lazy hormone? आपके ब्रेन में बहुत सारे केमिकल्स होते हैं, बहुत सारे हॉर्मोन्स होते हैं. ठीक है, सो इफ दिस इज वन न्यूरॉन, आपके ब्रेन के सेल्स को न्यूरॉन कहा जाता है. सो इफ दीज टू न्यूरॉन्स हैव टू पास ए मैसेज, अगर ये दोनों न्यूरॉन्स को कम्युनिकेट करना है, देन दे विल यूज hormones. Okay, plus they will use something called as neurotransmitters. Okay, so there are many neurotransmitters in your brain. Amongst that, GABA is one of the neurotransmitter. Okay, so the progesterone will interact with the GABA. Okay, and it will reduce the transmission which is taking place between the two neurons. ठीक है, सो जब ट्रांसमिशन रेड्यूस होता है, दैट मीन्स व्हाट, देयर इज नो न्यूरोनल एक्टिविटी. There is no neuronal activity, that means there is no message. Fine, so the body goes into a resting mode. If there is neuronal activity between the two neurons, then there is some message which is passed, and that then the body has to act. It can be anything. Okay, you have to go somewhere, you have to study, you have to write something, you have to do some work. So for all that, you need the neurons to interact between each other. If that interaction does not take place, that means the body will ultimately go into a resting mode. Okay, so if the progesterone falls down, now imagine it has calming effect on the body. Okay, now if this is going low, okay, अगर प्रोजेस्टेरॉन का लेवल गिर जाता है, तो calming के opposite क्या होगा? The person will always be irritated. Okay, the person will, if there is irritation, that means there is no motivation to work, or if there is irritation, there is no happiness present in that person. So what happens to that person? Ultimately, there is going to be depression and anxiety which comes along, okay, with irritation. Fine, so this is progesterone. So if there is low progesterone, again what happens? Now again you will say यहाँ पर भी irregular menses है. That is because progesterone and estrogen both have effect on your uterus. Okay, and the function of your uterus, आपके uterus का काम यही है to maintain a regular menstrual cycle, or to maintain regular periods. So if both these hormones are not functioning properly, or both these hormones are not present properly in the body, then obviously it is going to, first and foremost thing it is going to affect is, it is going to affect your menses. ठीक है, next is प्रीमेंस्ट्रुअल स्पॉटिंग. प्रीमेंस्ट्रुअल स्पॉटिंग मीन्स व्हाट? मेंसेस आने से पहले स्पॉटिंग होती है. जो स्पॉटिंग होती है वो काफी लंबे टाइम तक होती है. वी हैव फीमेल्स हु हैव स्पॉटिंग फॉर ऑलमोस्ट 10 to 12 days, and then after that spotting their menses start. Okay, so you imagine almost 20 days out of your 28 or 30 days cycle, almost 20 days go into go into that menstrual phase or spotting phase. So again that is wrong. क्यों? क्योंकि अगर 10 to 12 days spotting हो रही है तो that will decrease the levels of blood. Okay, plus it will decrease the levels of iron and hemoglobin in the female's body. So if iron and hemoglobin fall down, that will again have effect on the entire well-being of that female. Okay, next is again mood change. I told you every hormone will have change of mood, will have anxiety and depression. Okay, next is sleep disturbance. Now as I told you here, it is having a calming effect, that is the body is going to go in a resting mode. तो अगर body resting mode में जा रही है, that means जो woman है वो obviously she'll tend to sleep more. Okay, but since there is low progesterone, the female cannot maintain a good sleep cycle, so obviously she's going to have sleep disturbances. Fine. Now next is when the progesterone go high, that is when they increase in the body. Okay, so when they increase in the body, normally जब वो present होते हैं, that time there is calmness and there is resting mode. If it increases more, then obviously the capacity to sleep or the tendency, more than capacity हम tendency कह सकते हैं या फिर frequency कह सकते हैं, the tendency and frequency to sleep is going to obviously increase more. Fine. Along with that, there is going to be increase in bloating and dizziness. Fine. Now what is the reason for increase in dizziness and yeast infection? Now if we see at dizziness is what? Dizziness is where there is normal language, if you will call, सिर घूमता है, ठीक है? So that is called as dizziness. So that happens because there is fall in the level of your blood pressure. Okay, along with that even the glucose level falls down. Okay, so because of these two things there is dizziness. Next comes yeast infection. Yeast infection comes into picture because the normal pH of your vagina or the normal guarding mechanism of the vagina is compromised. When there is increase in progesterone, there is too much of moistness at the tissue level of the vagina. So since there is lot of moisture, increase in the moisture, that is going to give rise to any kind of infection which happens at the vaginal area. Okay, now let's come to some clinical condition. We'll just see the overview of what exactly this is. आप लोगों ने almost सभी ने सुना होगा about this, that is PCOS or polycystic ovarian syndrome. Normally what happens in this is there are two ovaries in female bodies. Okay, तो हर एक ओवरी का काम रहता है कि वो हर month it is going to produce one egg which is going to go to your uterus for fertilization. और अगर fertilization नहीं होता है then there is going to be periods or menstrual cycle. Okay, तो ये एक cycle जैसे चलता है. If you see here, okay, तो ये एक cell होता है जो develop होता है, mature होता है, and then this egg is released every month which goes to your uterus here. Okay, and if there is no fertilization happening, then there is menstrual cycle. Fine. अगर ये eggs properly mature नहीं होते हैं, okay, जैसे आप यहाँ देखेंगे, see it is not getting matured. Fine, here it is not getting matured. तो जब ये mature नहीं होता है then there is fluid retention in those cells, that is fluid या फिर आप पानी कह सकते हैं, which starts getting accumulating inside these cells, okay, and they swell up. So that is why अगर आप कोई यूएसजी देखेंगे पर आप कोई अल्ट्रासाउंड देखेंगे पीसीओएस का, तो उसमें they will tell you that there are lot of cyst present, okay, so that cyst is nothing but fluid retention inside those cells. Fine. So there will be no maturation of the egg, so there is no release of egg in the fallopian tube. आप देख रहे हैं ये egg यहाँ release हो रहा है, वो यहाँ release नहीं हुआ है. So that is why there is going to be irregular menses, or the periods are not going to be regular in PCOS. Okay. अब इसका reason क्या है, ये क्यों होता है? First and foremost thing is there is increase in androgens. Okay, what are androgens? Androgens are nothing but they are male hormones. Okay, they are not female hormones, they are male hormones. तो जब मेल हार्मोन की कैपेसिटी या फिर जब मेल हार्मोन्स का जो लेवल है वो अगर बॉडी में बढ़ रहा है, अभी many of you come with the doubt that it is a female body, so how does it have a male hormone? Ideally all hormones are present in both the genders, okay. Even males will have estrogen and progesterone, but that is going to be present in a very, very small amount, okay. Same goes with women. Even women will have male hormones, they'll have testosterone, they'll have androgen, but it is going to be present in a very small amount, ठीक है. तो उसके वजह से उसके फीचर्स जो मेल फीचर्स है वो हमें दिखते नहीं है, लेकिन जब जब ये मेल हॉर्मोन्स फीमेल बॉडीज में बढ़ते हैं, उसका अमाउंट बढ़ता है, then we start seeing male type of features. Now what are those male features? We will see. Okay, so first इसका रीजन क्या होता है वो पहले हम देखेंगे. तो आप यहाँ देख रहे होंगे इंसुलिन रेजिस्टेंस. अभी व्हाट इज इंसुलिन रेजिस्टेंस? आइडियली every human body has a specific level of insulin, ठीक है. आप खाना whatever food you eat, आप जो खाना खाते हैं that goes to your stomach, from stomach it is broken down, ठीक है. फूड का ब्रेक डाउन होता है स्टमक में और वहां से ग्लूकोज रिलीज होता है. तो ये जो ग्लूकोज है, ये ग्लूकोज को आपके मसल्स तक पहुंचना होता है, आपके बाकी के बॉडी के सेल्स, आपके बाकी के बॉडी के ऑर्गन्स, आपके हार्ट तक पहुंचना होता है. तो ये कैसे पहुंचता है? इट गोज थ्रू योर ब्लड, ठीक है. अभी ब्लड में भी ग्लूकोज कैनॉट गो इटसेल्फ और इट कैनॉट गो अलोन, इट नीड्स सम binding agent, okay, so that glucose will bind on the insulin, ठीक है. Glucose will go and sit on the insulin, and that is how the insulin will help in passing the glucose from the stomach to different parts of the body, and that is how आपको ग्लूकोज से एनर्जी मिलती है. फाइन. लेकिन what happens in insulin resistance is, let's take an example. आपके पैंक्रियाज जो है वो आपके बॉडी में इंसुलिन प्रोड्यूस कर रहे हैं अराउंड 10 यूनिट्स, ठीक है. दिस इज जस्ट एन एग्जाम्पल. फाइन. अगर 10 यूनिट्स इंसुलिन आपने खाना खाया है एंड दी पैंक्रियाज आर प्रोड्यूसिंग 10 यूनिट्स. फाइन. So that 10 units will go into your blood, and it will along with glucose it will pass through different parts of the body, ठीक है. अब एक कंडीशन ऐसा है जहां पर आपका पैंक्रियास जो है वो 10 यूनिट्स प्रोड्यूस कर रहा है, ठीक है. लेकिन ये 10 यूनिट्स आपके ब्लड में जा रहे हैं, लेकिन जो ग्लूकोज है इट इज नॉट डिटेक्टिंग दीज 10 units, as in it is not able to recognize, or it is not able to see, or it is not able to appreciate the presence of these insulin present in the blood. Fine. Now what happens to the pancreas? It gets a signal that whatever insulin you had produced, that is not recognized by the body. So what pancreas does, वो और 10 units produce करेगा. फिर से ये 10 units भी बॉडी रिकॉग्नाइज नहीं कर रही है, फिर से अगेन इट इज गोइंग टू प्रोड्यूस 10 यूनिट्स. सो लाइक दिस इट इज गोइंग टू गो ऑन प्रोड्यूसिंग. तो व्हाट इज हैपनिंग इन द बॉडी? there is excess insulin in the body, जिसको बॉडी की जरूरत नहीं है बिल्कुल भी. ओके, so that condition is called as insulin resistance. Fine. So what happens when the insulin increases excess in the body? एक तरफ इंसुलिन भी बढ़ रहा है, एक तरफ ग्लूकोज भी बढ़ रहा है. ग्लूकोज कैसे बढ़ रहा है? इट इज, आप खाना खा रहे हैं, but that glucose is not getting digested, or it is not going to your muscles where it is going to be used in the form of energy, and it is going to get removed from the body, okay, through sweating. So it is not happening. So on the other side, even the levels of glucose is going to increase. So what is happening? Insulin भी बढ़ता है, glucose भी बढ़ता है. ठीक है. So अगर ये condition काफी टाइम तक मेंटेन रहा, अगर कोई ट्रीटमेंट नहीं ली है इसके लिए, तो what will happen? The person will go into a condition called as diabetes mellitus. Okay, fine. That is, or you can say it as type 2 diabetes, where there is increase in too much of glucose in the blood. ठीक है, तो ये एक रीजन होता है पीसीओएस होने का. सेकेंड रीजन इज हाइपोथायरॉयडिज्म. Okay, next is hypothyroidism. See, this is what happens in insulin resistance. जब आपके बॉडी में बहुत ज्यादा इंसुलिन और बहुत ज्यादा ग्लूकोज का प्रमाण होता है, that time you will have craving for sweet. Okay, basically you will have craving for all types of very bad carbs. Bad carbs in the sense, all those fast food, all those fried stuff, all that unsaturated fats, and all types of अनहेल्दी चीजें जो होती है उसके लिए आप क्रेव करेंगे. सो दैट इज the first sign of insulin resistance, and you all should understand, या फिर you all should be able to recognize this sign, that is craving for unhealthy food. That is called as insulin resistance, first sign of insulin resistance. Okay, next is आपके बॉडी में जो ग्लूकोज बना है, what I explained you now, that is not reaching your muscles and that is not reaching your vital organs. So because of that, you will always have fatigue. Fatigue is, you will always feel tired. ठीक है. नेक्स्ट इज फ्रीक्वेंट और इंक्रीज्ड यूरिनेशन, जो आप डायबिटीज के फीचर्स में भी देखते हैं. देयर इज फ्रीक्वेंट urination or frequent micturition. So that is because increase in the levels of glucose. Okay. Next comes darkening of skin in groin and armpits. This is because there is too much of melanin. What is melanin? Melanin is a skin pigment. Okay. आपके skin को जो कलर या फिर कलर का जो कैरेक्टरिस्टिक्स आता है, दैट इज थ्रू दी मेलानिन. सो जितना ज्यादा मेलानिन होता है उतना ज्यादा स्किन का शेड डार्कर होता है. ओके, सो दैट मेलानिन, देयर इज abnormal deposition of too much of melanin in these parts of your body, that is groin, armpits and behind the neck. Next is increased hunger or thirst. Okay, and another thing is tingling sensation in hands or feet. अभी tingling मतलब क्या होता है? Tingling is like, you can say you have numbness, that is चीटियाँ आती है. Then there is altered sensation in periphery of your body. Periphery is what? The hands. Okay, this is the periphery, and central part is your trunk. Okay, so periphery is hands and legs. So in parts में, in body के parts में, if you have tingling, if you have numbness, then that is again a sign of insulin resistance and too much of glucose in the body. अभी tingling और numbness क्यों आता है? Because the glucose which is excess in your body, which is not getting digested, that is going to go and sit in your nerves. Okay, that is going to wrap around your nerves. So the nerves will get thick and they will not be able to function properly. तो इसलिए tingling और numbness होता है. तो अगर आपको ये सारे signs इसी में नजर आते हैं, या फिर even you experience it some or the other time, then it is your responsibility to go and take medication or go and take treatment for this. Okay, और ये science बहुत easy है to remember. It is not something very difficult. So I think you all should be able to correlate if at all anything happens like this with you. Next is hypothyroidism. Now what is hypothyroidism? Ideally आपके थायराइड का काम होता है कि वो कुछ हार्मोन सेक्रीट करे. ओके, तो वो हार्मोन्स आपके बॉडी के बाकी फंक्शंस पर असर करते हैं. फाइन. नाउ इन दिस कंडीशन व्हाट हैपेंस इज द hypothalamus in the first slide जो हमने जो देखा था, hypothalamus is secreting something but it is not reaching the thyroid and it is not reaching the ovaries. So that is hypothyroidism, where the thyroid is not functioning properly. It is not able to reach the respective body part properly. So that is hypothyroidism. So in case of hypothyroidism, this side if you see, these are all features of hypothyroidism and these are features of hyperthyroidism, where thyroid will produce excess hormones. Okay, but as of now for our condition we need only hypothyroidism जहां पर thyroid sufficient hormones produce नहीं कर रहा है. ठीक है. So in that condition, how to recognize that you have signs and symptoms of hypothyroidism? There is going to be dry hair. The hairs are going to be brittle, dry and very dull. Okay, so that is first sign. Next is puffy face. That is increased of too much of fluid retention in the body. आपकी किडनी का काम होता है कि जो एक्स्ट्रा फ्लूइड आपकी बॉडी में है वो थ्रू यूरिनेशन इट विल थ्रो आउट. बट इन हाइपोथायराइडिज्म द किडनी कैन नॉट फंक्शन प्रॉपर्ली, सो वो फ्लूइड पूरी तरह से बाहर नहीं निकाल पाता है. सो दैट फ्लूइड स्टार्ट्स गेटिंग रिटेनिंग इन योर बॉडी. So that is why you get that swollen appearance. Many of you must have seen your relatives or your immediate family members who have hypothyroidism, who take that medicine every morning. They will have such symptoms of puffy face. Okay, goiter is again swelling of the thyroid. Okay, then the heart rate will be always poor or will be always low. Then there will be increase in weight or obesity and constipation. Okay, and they will be always cold intolerance. They cannot tolerate cold environment or they cannot tolerate cold temperature. So all these are signs of hypothyroidism. So if someone has insulin resistance and hypothyroidism both, then they can have PCOS. Okay, now one more important thing that we have to discuss is दो चीजें होती है, एक PCOS और PCOD. इवन आप लोगों ने भी सुना होगा. ठीक है. सो व्हाट इज द डिफरेंस बिटवीन दिस? अगर आप PCOS देखेंगे, ओके, तो इसका फुल फॉर्म क्या है? पॉलिसिस्टिक ओवेरियन सिंड्रोम. ओके, और अगर आप PCOD देखेंगे, दैट इज पॉलिसिस्टिक ओवेरियन डिजीज. फाइन. So this is the difference between this. Fine. Now जब आप syndrome की बात करते हैं, syndrome means what? Syndrome will be cluster of too many symptoms or too many signs or too many conditions together. So that is called as syndrome, जिसमें एक या दो से ज्यादा आपको हेल्थ इश्यूज हो सकते हैं या फिर एक या दो से ज्यादा सिस्टम्स, आपकी बॉडी के सिस्टम्स इन्वॉल्व होंगे. दैट इज पॉलिसिस्टिक ओवेरियन सिंड्रोम. Okay, PCOD is where only your reproductive system is going to be involved in this. Fine. Now when it comes to fertility, PCOD does not affect your fertility. Okay, but PCOS will affect your fertility. Why that happens is because PCOS का जो control है, that comes from your hypothalamus. Okay, hypothalamus, your thyroid and then your uterus and ovaries. Fine. So because of that there is difference between these two. अब ये दोनों भी चीजें जो है, जो आप अभी हम देख रहे हैं, PCOD and PCOS, both are lifestyle disorders. Okay, both are lifestyle disorder. Lifestyle in the sense आपके जो डेली लिविंग का रहन सहन का जो तरीका है, उसके वजह से होने वाली जो कंडीशंस होते हैं उसे हम लाइफस्टाइल डिसऑर्डर्स कहते हैं. ओके, सो बोथ दीज कंडीशंस आर going to be reversible. You can change it, but again it needs lots of efforts. Okay, आपको बहुत consistent रहना पड़ता है with your routine, with your medicines, with your habits. Okay, तब जाके आपको एक अच्छा बेटर चेंज दिखता है. Don't get demotivated with the thought that you cannot reverse PCOD or PCOS. With healthy living, with maintaining a good lifestyle, with maintaining a good diet, everyone can reverse PCOD and PCOS. Okay, fine. Now let's see the symptoms, signs and symptoms of PCOS. Fine. So इसमें there is going to be, अभी जो physical features है उसमें it is going to affect your hairs. There is going to be hair loss. ठीक है, बालों का झड़ना. और hirsutism is nothing but there is going to be excess growth of hairs on the face. Okay, facial hairs are going to increase, and the hairs, wherever there are hairs present on your body, that is your hands, your legs, even on feet, few people have hairs on their feet, small hairs, but those hairs are going to increase. Okay, they will increase in size and they will increase in girth. That is, their thickness will also increase, and they will be very prominent on physical appearance. So that is called as hirsutism. Okay, that happens in males. If you observe male body, they have too long hairs, too thick hairs on their chest, on their legs, hands, and even at the jawline they have. That is where they maintain beard. So in males those features are present. तो वही same features females में दिखने लगते हैं when there is PCOS or PCOD. Okay, next is pelvic pain. Pelvic pain or pelvic discomfort, you can say. This is present because there is bulging of the uterus. Okay, why? Because there is irregular menses. So because of that, the female will always have a pelvic discomfort or pelvic pain. Fine. Next is infertility. Then again, increase in weight, irregular menses, fatigue. Fine. And high testosterone levels. Now, high testosterone is what? Increase in, again, male hormones. And because of that, there is going to be this thing, hair loss. Hair loss in the sense, male pattern hair loss will be there. What is male pattern hair loss? We'll see it. Okay. And there is going to be acne. Acne is because the sweat glands, आप हर किसी के स्किन में sweat glands होते हैं जो पसीना प्रोड्यूस करते हैं. Along with sweating, they also produce little oil. Okay, so that oil is responsible for maintaining the moisture of your skin. Okay, they maintain the moisture of your skin. So if that moisture is not maintained properly, and if those glands, sweat glands, they start producing too much of oil, then there is deposition of bacteria in those sweat glands. Okay, और acne का mechanism ही वही है कि जब बैक्टीरिया डिपॉजिट होती है स्किन पर या फिर स्वेट ग्लैंड्स में, दे स्वेल अप, and that is how they produce pus in the acne and they increase in size. So all these things will happen if there is surge of hormones. Okay, so these are the symptoms of PCOD. अभी आपको पता कैसे करना है कि आपको PCOD या PCOS है कि नहीं. Okay, so you have to have any two signs amongst these three. ठीक है, आपके स्क्रीन पर जो दिख रहे हैं इसमें से कोई भी दो चीजें अगर आप में है या फिर आप एक्सपीरियंस कर रहे हैं, देन यू शुड गो एंड कंसल्ट ए डॉक्टर. ओके, तो सबसे पहले चीज है इरेगुलर ओव्यूलेशन. इरेगुलर ओव्यूलेशन इज नथिंग बट इरेगुलर मेंसेस. ओके, अगर आपके पीरियड्स रेगुलर नहीं है then that is one thing. Okay, second is signs of increased androgen levels. Okay, that is androgen levels means what? Androgen is nothing but a male hormone. ठीक है, तो मेल के जो फीचर्स है उस रिलेटेड फीचर अगर आप कोई देख रहे हैं अपने बॉडी में, देयर इज इंक्रीज इन फेशियल हेयर. ओके, द हेयर लॉस. ओके, इन मेल्स इफ यू सी ideally they have this type of hair pattern, that is the lateral part of the hair, which like you can see, which I have right now. If the female tends to get hair fall in this pattern. Okay, अगर female का hair loss इस pattern में होता है, यहाँ आगे के जो बाल है, if they start falling off or if they start becoming thin, then that is called as male pattern or male pattern baldness. Okay, so if the female starts experiencing these things, then that is one sign of PCOD. Okay, plus अगर आप USG करते हैं तो USG में if you see small cysts or small bulky appearance of round structures in the ovaries, then these are the signs of your PCOD, and then you can further go for next evaluation. Okay, so अभी तक हमने जितने भी symptoms देखे हैं, you have to monitor it throughout your life if you experience that. Fine. Now what are the things which we can do if once on getting diagnosed? What is your responsibility towards your body? The first and foremost thing is you have to go and consult to a doctor. Okay, you can meet a dietitian. आप एक dietitian से मिल सकते हैं जो आपका routine डाइट जो है उसमें कुछ चेंजेस करके या फिर उसमें कुछ ऐड ऑन करके आपको एक डाइट प्लान दे सकते हैं. प्लस if you have too much of psychological features, if you have too much of mood swings, then again you can meet a therapist. Fine. Now first and foremost thing is diet change. Now what all can you do in the diet changes? You have to make sure that जितने भी unhealthy सैचुरेटेड फैट्स है या फिर जितने भी वाइट वाइट फ्लावर आइटम जो है, वाइट फ्लावर इज नथिंग बट योर मैदा. ओके, सो मैदा along with that जितने भी high gluten producing agents है, gluten is nothing but again a sticky enzyme, or you can say sticky sugar, which is present in our food. Okay, so if that all these things, if they are present in excess, then you have to avoid those foods. Fine. So here you can see all these things. Plus females who are having PCOD, they have to avoid dairy products. Okay, dairy products जितने भी आते हैं, they have to avoid it. Fine. You can go with ग्रीन लीफी वेजिटेबल्स. आप हरी सब्जियां खा सकते हैं, फ्रूट्स खा सकते हैं, फिश खा सकते हैं, देन पल्सेस खा सकते हैं, स्प्राउटेड पल्स खा सकते हैं. ऑल दीज थिंग्स विल हेल्प इन मेंटेनिंग ए regular hormonal level or good hormonal level. Okay, so that is what is in diet changes. Next is aim for anti-inflammatory. Aim for anti-inflammatory means I already, because of PCOD, there is going to be too much of inflammation in the cells. Inflammation is nothing but swelling. ठीक है, सूजन. तो आपके बॉडी के जो सेल्स है वो ऑलरेडी इस चेंज से जा रहे होते हैं, because there is too much of sugar in the body, there is too much of other hormones in the body. तो जो cells है वो हमेशा swelling में रहेंगे. So to reduce that swelling, you have to take anti-inflammatory food. Okay, so anti-inflammatory food means what? You have to make sure that you avoid too much of spicy food. Okay, you avoid too much of fatty food, then you avoid too much of sweet. All these things will reduce the level of inflammation in your body. Okay, along with that, cinnamon water, that is cinnamon is nothing but dalchini. Okay, so cinnamon water is very important in PCOS to reduce the levels of inflammation. So regularly, if you increase the intake of cinnamon water, then that is also going to be beneficial. Next is you have to maintain balance of carbs and protein intake. ऐसा नहीं है कि आप सिर्फ carbs ही खाएंगे, okay, and no proteins. ऐसा नहीं करना है. You have to maintain a balance between both. Okay. Next is you have to increase your iron, magnesium and zinc intake. So all these things are important for maintaining a good cellular state in the body. Okay, तो अगर आपकी cells normal है तो they will also produce normal hormones, or they'll produce normal levels of the hormones. Okay, next is practice good sleep hygiene. Abhi what is good sleep hygiene? Sleep hygiene is nothing but आपको एक specific time fix करना है. Okay, for your sleep every day. You have to strictly abide to that specific time which you have fixed. Okay, you have to maintain a 7 to 8 hours duration of sleep every day, which is important for your body to shut down and to take rest and to carry out its remaining process which happen when you sleep. Okay, and avoiding any kind of social media or avoiding any kind of LED lights or any kind of blue light. More than LED, I'll say blue light आपको सोने से पहले avoid करनी है. Why it is important? Because when you sleep, there is a hormone called as melatonin, which is produced by your brain. Okay, तो melatonin तभी produce होता है जब darkness होता है. ठीक है. And many of you, when you sleep, you always have your phones with you. आप हमेशा phones के साथ सोते हैं. Without phones you cannot sleep. So because of the light of the phone, melatonin जो है वो produce नहीं होता है sufficiently, and because of that there is poor sleep. Okay, and you know the adverse effects of poor sleep. जब आपकी नींद अच्छी नहीं है तो you tend to have all other health issues. Okay, so because of that you should avoid using any kind of blue light when you sleep. फाइन. तो ब्लू लाइट रिलेटेड जितनी भी चीजें हैं वो आपको अवॉइड करनी है, फिर चाहे वो टीवी हो, लैपटॉप हो, आपका फोन हो, ऑल दीज थिंग्स यू हैव टू अवॉइड. ओके. नेक्स्ट इज लिमिट और अवॉइड एंडोक्राइन डिस्ट्रप्टर्स. दैट इज ऑल दीज काइंड ऑफ केमिकल्स. ठीक है. अब ये सारे केमिकल्स किस में प्रेजेंट होते हैं? आप जो शैम्पूज यूज करते हैं, आप लोशंस यूज करते हैं, आप परफ्यूम्स यूज करते हैं, बॉडी मिस्ट हो गया, यू यूज क्लीनिंग एजेंट्स, डिटर्जेंट्स यूज करते हैं, सोप यूज करते हैं, तो ये सारी चीजें उसमें प्रेजेंट होती है. ओके. Nowadays there are skin friendly, or you can say body friendly products which are coming in market. तो आप जब भी कोई भी चीज खरीदते हैं, so always go and read their contents. So in the contents, if you see sulfates, if you see dioxins, if you see glycol ethers, all these things, so you have to try to avoid, because when they penetrate inside your skin, वो आपके skin के अंदर penetrate होके, when they go through your cells, they go and enter your bloodstream, then they go through your various organs, so they tend to have they tend to disturb the function of your body and disturb the function of that organ. Okay, so you have to avoid using things which have these chemicals. Now let's come to our very important topic, that is emotional health. Now when we talk about emotional health, we have to make sure that there is a little understanding of how a female actually processes her thoughts. Now I have studied brain since a long time. I have studied human brain since a long time, and throughout my knowledge, or throughout my study, what I have understood is that female brain is wired in such a way that she will always be empathetic to everyone, फिर चाहे वो कोई भी हो. Okay, she is always going to be empathetic to everything. Okay, she'll always have more affection, she'll always have more empathy, she'll always have more attachment towards everything. फीमेल का ब्रेन ही वैसे बनाया गया है, या फिर उसकी वायरिंग वैसे होती है. So that is why it is very difficult for females to stay away from any kind of जैसे मेल्स में आप देखते हैं, they are not having so much of attachment. Very few males you see they'll have attachment towards things, and very few will have good emotions. Okay, जो emotional होने की जो capacity है वो females में इसीलिए ज्यादा होती है, because of the wiring of their brain. Plus if you observe their level to understand a emotional situation, that is more I think they perceive it more better than men. Okay, they understand it in a deeper way compared to men. So that is why females, I would say that females are born for connection and empathy. So if you want to understand, अगर आप emotional health को समझना चाहते हैं, तो you have to understand how a female brain works. Okay, आपको उसके हार्मोन्स और उसके साथ जो इमोशनल बैगेज आता है, या फिर जो इमोशनल इन्सिडेंसेस आते हैं, you have to understand all that. Okay, so whatever has happened before, okay, जैसे a female will have some life experience. Okay, so that life experience will have some kind of responsibility also. Let's take an example of a female jiska who is married and who has a child. Okay, so after some time she loses a partner. Okay, तो पार्टनर के जाने का पूरी रिस्पॉन्सिबिलिटी कम्स टू दैट फीमेल. सो इमेजिन, आप एक सीसॉ इमेजिन कीजिए. तो सीसॉ के एक तरफ उसका बच्चा है एंड द अदर साइड शी हैज टू मेंटेन हर responsibilities. She has to take care of her family, she has to take care of her child, she has to make sure that the future of her child is secure. Okay, so if you start loading both sides, that is her responsibility towards her child plus her responsibilities towards everything, if you start loading both sides of the seesaw, what is going to happen? The seesaw is going to spank from the middle. Okay, it is going to break from the middle. So that we called it as allostatic loading. We call it as allostatic loading. So to avoid allostatic loading in emotions, it is responsibility of every female to understand her abilities, to understand her brain and modulate the emotions accordingly. Okay, next is the earthquake theory. Now, what is earthquake theory? If you this is a very easy way to understand emotions. Okay, so if you go through every life instance, मतलब आप अभी recall कीजिए कि आपका जो difficult time था सबसे, वो कौन सा था. So if you go through all those instances, you'll understand what actually happened throughout your life instances. So I'll give one example. There was a female who like during her teenage, she her mother got cancer. Okay, her mother was diagnosed with cancer. So she was just 15 years old when her mother was diagnosed with cancer. So because of that cancer, she could not complete her education properly. Okay, next step that happened after 3 years was she lost her younger sister. Fine. So you imagine a mother on one side who has cancer and her sister who died at a very young age. Fine. So you imagine the mental stress of that female. Next is that when she got married, she was about to have her own child. Her mother had relapse of the cancer. Okay, so what happened? She had the first tremor, that is, her mother got cancer when she was 15 years old. Okay, next thing is she again lost her sister. So there was another tremor. Okay, now if the tremors go on increasing like this, okay, so her tremors, what happened to her tremors? Her tremors increased. She lost her sister. Then her mother got relapse of her cancer when she was going to have her own child. Okay, when she was going to deliver her child, she had to take care of her mother because of the cancer, plus she had to take care of herself because she's going to deliver. So all these tremors, if they come along, okay, back to back, or if they come along after certain intervals, then they give rise to something called as earthquake. Okay, now because of these tremors, what happens? There is already emotional disturbance. Okay, now if the tremors go on increasing, then they are going to give rise to something called as emotional earthquake. Okay, which is not normal. Fine. So if you want to analyze these things, अगर हमको earthquake को control करना है, ठीक है, या फिर हमको earthquake के लिए preventive measures लेने हैं, तो what we do? First we understand कि earthquake कहाँ से आया था, क्यों आया था, किस intensity से आया था. Okay, so you go back now. अभी आप वापस जाके you recall whatever instances you had in your life till now, whatever difficult times you had till now in your life, you go and recall them. Okay, that is where you will find solution for your trouble. Fine. Now next is very important part, that is menstrual cycle and mood. Okay, now as I told you earlier, this is a very beautiful definition of what exactly is menstrual cycle. It is the dialogue between your brain and ovaries. Okay, now if you see your menstrual cycle, there are basically three cycles in that. So the first phase is the follicular phase, the next is ovulation, and the next is luteal. Okay, now if you, we had one diagram, right? Here, okay. So what you see here, okay, the eggs are maturing, or these are nothing but the follicles. So the follicles are maturing. So this is called as follicular phase, where the follicles mature, okay, and then they release one egg every month. Okay, so that is called as your ovulation phase. So this is your first phase, and this is your second phase of ovulation. The next phase is where the egg will travel down towards your uterus. That is, it will come here. Okay. Now, the uterus has to prepare itself for the lodging of this egg. Okay. So, if the egg has to lodge here, then the uterus has to prepare its lining so that it can hold the egg. So, ये सारे process में there is change of hormones again. Okay, so if you look at the first phase, that is the follicular phase, what happens here is the estrogen is going to be in large amount. Okay, there is going to be too much of estrogen. So if your menstrual cycle, let's say if it is of 28 days, okay, so out of that, the first 14 days will be the follicular phase, where it is going to prepare the egg, or it is going to prepare the follicles, and then it is going to do ovulation. So till ovulation, the estrogen is going to be high. Okay, the minute ovulation happens, the estrogen levels fall down. Okay, so because of that, there is going to be what? Because of that, there is going to be mood fluctuations. Okay, अब तक आपका मूड अच्छा था, fine, because there was good estrogen even in ovulatory. But after ovulation, what happens is you have mood fluctuations. Okay, and then during your menses, आपका mood और खराब होता है. Okay, so till here your hormones are good because of estrogen. Then from here it starts worsening. Okay, now there are few females जिनको menses से before their periods start, they have issues with their mood. Okay, अभी आप बोलेंगे कि menses start होने के पहले कैसे हो सकता है? During menses it is fine, but how does it happen before menses? So ideally every female will go through the hormonal changes, but those who are sensitive towards the hormonal change, जिनमें hormonal changes की sensitivity ज्यादा होती है, they will have something called as premenstrual syndrome and premenstrual dysphoric syndrome. Now we'll see what are they. Okay, now in premenstrual syndrome, what happens is before starting your menses, आपके periods आने से पहले, you'll feel tired, you will have irregular headaches, there is going to be bloating, and you are going to be irritated. Okay, आपका काम ठीक से नहीं होता है, आप काम पूरे कैपेसिटी के साथ काम नहीं कर सकते. Then your work, whatever you do, there will be some flaws in that. Fine, so that is where you are irritated, and because of that you are not able to function properly, but still you are doing your work. Now what happens in premenstrual dysphoric disease? Now in this, or disease or disorder, what happens in this is ये सारे जो symptoms है वो इसमें severe दिखते हैं. Okay, there is going to be lot of irritation. ठीक है, severe irritation होता है, severe mood swings होते हैं, that is there is severe forms of any kind of mood. Okay, then there is too much of baggaging of work or too much of baggaging of tension, stress. So ये सारी चीजें severe form में होती है, because of which they are day-to-day life is also affected. Here, the female can do her daily life, daily activities और day-to-day lifestyle जितनी भी है वो maintain कर सकते हैं. But in dysphoric disorder, the symptoms are so severe that the female cannot do her daily activities. Okay, so if इनमें से कोई भी चीज अगर आप अभी रिकॉल कर पा रहे हैं that you have been through all this or you have experienced all this, then kindly go and take consultation or approach someone. Okay, now how to overcome all these things. आपको एक चीज याद रखनी है कि there is always a physical finding, there is always a emotional finding for any kind of emotion. ठीक है, सो ये एक मॉडल है जिसे हम टूल बॉक्स कहते हैं. तो इसमें 3 चीजें आती है. एक फिजिकल टूल्स है, नेक्स्ट इज योर इमोशनल टूल्स, and next is your spiritual tools. So we'll see them one by one. So to overcome your physical tools, that is to always be energized. Physical means what? आपकी जो कैपेसिटी, बॉडी की जो कैपेसिटी है उसको हम फिजिकल बोलते हैं. ओके, सो आपकी फिजिकल कैपेसिटी अच्छी रहे, मेंटेन रहे. ओके, to have a good emotional level, you should always maintain this triad. Okay, this triad, that is, you should have a good sleep, you should have proper body mobility or exercise, and you have to maintain a good diet or nutrition. Okay, so all these things you have to maintain. Fine. Next is your emotional tools. Now in emotional tools, you should learn to first embrace. Now ideally, जब भी आप it is very natural actually, if you go through any situation or if you experience any situation, सबसे पहली चीज आप क्या करेंगे? You will try to run away from the situation. ठीक है, आप पे कोई भी सिनेरियो हो, the first, it is a very natural human instinct actually, you will try to run away from that situation. आप भागने की कोशिश करेंगे या फिर you will try to remove yourself from that scenario. Okay, so that thing you have to learn to embrace. Embrace in the sense you have to learn to embrace your emotions. Okay, अगर आप sad feel कर रहे हैं, okay, अगर आप if you are angry, let's take an example of this. If you are angry, then you have to learn to embrace that yes, I am angry. Okay, अगर आपसे कोई आके पूछता है कि what happened, why you're not talking, what you will say? Nothing, I am fine. Okay, so you have to learn to first agree or first to tell yourself that yes, I am angry, yes, I am sad, or yes, I am not keeping well. Okay, so first thing is feel the emotion. आपका जो भी emotion है, sad, happy, anxious, angry, whatever it is, feel that emotion. Okay, next is आपको आपके इमोशंस एक्सप्रेस करने हैं. अभी आप एक्सप्रेस कैसे करेंगे? एक फॉर्मूला है, दैट इज टीयर्स. ओके, T stands for talking. Okay, so you have to learn to talk out. Okay, you have to learn to speak, you have to learn to express whatever you're feeling. तो अगर आप sad feel कर रहे हैं तो you should learn to talk about it, that yes, you're not feeling good, you're sad. Okay, next is E. E stands for exercise. Okay, or physical activity, any kind of physical activity or exercise. Fine, so you have to do that. Next is A. A is artistic expression. Okay, I don't know how many of you have that thing. I had one of my friend, whenever she used to be sad, or whenever she used to be angry, or whenever she used to be happy, she was a very good artist actually. So she used to go and draw it. ठीक है, if she is angry, if she is sad, if she is feeling low, she'll just go and sketch it out. ठीक है, तो अगर आपका ऐसा कोई जरिया है, it is not necessary that you have to draw. Many of you sing, many of you dance, many of you write poems, many of you make videos, many of you talk about it, many of you, you will prepare some animation out of it. Okay, so that is a kind of artistic expression. Next is R. So R is where you have to record it. Okay, so record it means what? You can again note it down in your diary. Okay, that so and so thing happened today, so and so was your reaction towards it. So that is a kind of recording. That is just an example. Fine. Next is S. Now S stands for crying or sobbing. Many of you जिनको भी गुस्सा आता है, जो सैड फील करते हैं, they 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 pretend not to show it in front of others. Okay, whereas कुछ लोग ऐसे होते हैं जो रो देते हैं, who start crying or who are always sobbing because of their sad life, because of their depressed life. But what I'll say is crying or sobbing is not a wrong thing. Okay, it is a way of expressing your emotion. Fine. So you have to make sure that you also bring out your emotions. Okay. Next is stop and alter your thinking. Abhi, one example we'll take for this is, if you are having always a procrastinating lifestyle. That is, what is a procrastinating lifestyle? There are few people जिनको कुछ काम करना है या फिर पढ़ना है, they will always delay it. I'll do it tomorrow. हो जाएगा. I'll do it next day. हो जाएगा. So that is a kind of procrastinating lifestyle. So what happens with them? They cannot be successful in their life. Why? Because they always tend to keep delaying their work or delaying their targets. So if that person will think about, instead of thinking that I'll do it next day, if that person makes a aim, if that person keeps a goal in life that I'll finish this work, then that is a alteration of that thought. Okay, so you have to, whenever you're sad, you have to try to alter your thinking. Now we'll see in next slide how to alter the thinking. Okay, next is create the thoughts and emotions you desire. Again, there are few techniques which we will see in next slide for this. Next tool is spiritual tool. So spiritual tool is nothing but many of them find peace, or many of them find calmness in spirituality. Okay, so that spirituality can be of any kind. Okay, so you can try that option also. Fine. Now next is mood swing and triggers. Now in mood swing and triggers, we will come across the conditions as well as the techniques for that. So the first thing is stress and anxiety. Now in stress and anxiety, what we see is anxiety comes along with a lot of its implications. Okay, so those implications are nothing but there is always going to be something called as disruption of your normal lifestyle. एक एग्जाम्पल लेते हैं, आपको रात को नींद नहीं आ रही है. ओके, it is already 2 or 3 a.m. in the morning, still you're turning your sides, then you are tending to to always have a thing going on in your mind, so you're not able to sleep. Okay, and then ultimately it is already 5 or 6 o'clock in the morning, so your sleep is lost and your entire day is spoiled because you do not have proper sleep. So that is an example of severe anxiety, where severe stress and anxiety, मतलब एक चीज है जो आपके दिमाग में चल रही है, then you start correlating it. That is, if I have to manage my finance, then I start thinking about my job change, then I have to think about my family responsibilities, my financial stability, then I have every month EMI. So it's like a cycle which goes on. So that is stress, and because of stress, like you tend to get anxious कि ये होगा कि नहीं, ठीक होगा कि नहीं. So that is anxiety, what we call. Okay, now anxiety is not only about stress, or it is not only about tension. Anxiety can be about any kind of phobias. Okay, it can be any kind of panic disorder also. Now what is phobia? Phobia is where आपको किसी चीज का डर होता है. ठीक है, जैसे किसी को पानी का डर है, किसी को फायर का डर है, ठीक है. सो लाइक दैट you can have fear of emotions also. Okay, phobia, let's give you an example that a phobia of emotion is where you will always fear of losing someone, or you will always fear that if I do not maintain a good financial stability, then my family will be unhappy because of me. They'll stop loving me. So that is a fear of emotion, okay, which you will have. Fine. Next is depression. Now anxiety always comes along with depression. So in depression what happens is, डिप्रेशन एक लास्ट स्टेज होता है. सबसे पहले आपके इसमें स्ट्रेस आता है. सो बिकॉज ऑफ स्ट्रेस यू टेंड टू गेट एंशियस, एंड देन this anxiety goes to depression if it is severe. Okay, now how to manage this anxiety or stress in initial state? How will you manage it? If you see, or if you look at the I'll try to play the video for you. This is one technique which you should always follow. जब भी आप बहुत anxious है, जब भी आप बहुत tensed है, okay, किसी situation को लेके आप tensed है, try to practice this at least once. Just a minute. This is a kind of breathing technique which is done to calm, to maintain a peace or to maintain calm.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Okay, so what we saw now was a technique called as box breathing. So in this, आप जब inhale करते हैं, that is when you breathe inside, you have to imagine, आपको ये box imagine करना है. Okay, तो आप यहाँ से सांस लेना अंदर start करें. So it has to be slow. Okay, so till you reach this height. Okay, so that is, it has to go gradually. You have to take the air inside एकदम धीरे से, ओके, एंड देन वो एयर को आपको होल्ड करना है अंदर, ठीक है, जो हवा आप ले रहे हैं, यू हैव टू होल्ड इट इनसाइड एंड देन slowly release it. Okay,
that are causing feelings of stress. Visible 2. This can be done. Pause again for 1 to 5 seconds as you go
then
along
again
the
आपको
bottom
वही
of the
रिपीट
box,
करना है,
traveling down the other side of the
आपको
box.
सांस उसी लेवल से छोड़नी है, that is
Pause
slowly you have to
again
leave
for 1 to 5 seconds
5
as you go
seconds वेट
along
करना है एंड
the
देन
bottom
अगेन
of
डू
the
इट.
box.
अब ये करने के आपको बेनिफिट्स क्या है बॉडी के, एक तो आप जब आप स्लो ब्रीथिंग करते हैं, ओके, व्हेन यू ब्रीथ स्लोली यू टेंड टू bring your entire mind or entire attention on your breathing. Okay, you try to practice it. जब आप whenever you breathe slowly you tend to focus on your breathing. Okay, so because of that whatever thought process is going on in your mind that is going to stop there itself. Okay, तो जब आपका thought process stop होता है that will stop further anxiety level. Okay, and then if anxiety is not chronic then there is no anxiety disorder and there is no depression. Fine. Second thing that happens is your breathing is regularized. Whenever you're tensed or whenever you're anxious your breathing is always altered. आप बहुत fast breathing करते हैं, so that increases your heart rate and that can give rise to any kind of condition. Okay, so if you practice slow breathing that will again help you in maintaining calm. Okay, next is 5 4 3 2 1 technique. So you just see the video then I can explain it to you.
The down 5. Use your senses to listening, standing, or laying down. Counting down from 5. Use your senses to list things around you. Make an effort
तो
to
आपको क्या करना है, आपको 5 चीजें जो आप देख सकते हैं, ठीक है, आप जहां पर भी है, आप बैठे हैं, खड़े हैं, सोए हैं, you have to note down 5 things which you can see. Okay, 4 things जो आप टच कर सकते हैं, जो आप छू सकते हैं, 3 चीजें जो आप सुन सकते हैं, ओके, 2 चीजें जिसका आप स्मेल ले सकते हैं और 1 चीज जिसे आप ज्यादा
notice
पसंद करते हैं.
details about these things. This is how to do it. Start by breathing deeply in through your nose and out through your mouth. Then slowly look at your surroundings. Find 5 things that you can see around you. Maybe you see a colorful poster on the wall, the spider web on the bookshelf.
So in this environment, this person, what all he can see this poster. 5 things which he can see is this poster. He can see a spider. Then I think there is a cat on the chair.
Lamp on the nightstand with the red shade. The cat sleeping peacefully on the chair. The cactus on the dresser that has finally bloomed.
Cactus.
Then list 4 things that you can touch.
Now 4 things
warm
जो आप
mug
touch
in
कर
your
सकते हैं.
hands. The soft comforter on the bed. The denim of your jeans. The scratchy carpet under your feet. Next, listen for 3 things you can hear. Maybe the ticking of a clock, the quiet hum of your computer, the sound of traffic from outside. Now try to find 2 things that you can smell. The tea in your mug, the clean scent of your clothes. Finally, list 1 emotion that you feel.
So he is feeling happy.
This
So
is a
that
way
is
to
his
ground yourself,
one
so you
emotion.
can feel present in the moment and in control of your surroundings.
So what we learned from this, हमने इससे क्या सीखा, that हम हमारे present situation में aware रह रहे हैं. That is what Buddha said. Okay, you have to live in the present situation. That is, whatever is happening around you, you have to embrace that. Okay, so that is what even this person did in the video, that he or she was trying to appreciate things around his or her which were present, which were in front of that person, and not those things which will happen in the coming days or which will not happen, but still we are thinking in our mind. The cycle is going on. Okay, so this is another technique. Now next is those who have issues with body image and self esteem. अब ये सारी चीजें कब आते हैं, जब PCOS में वेट बढ़ता है, या फिर in some conditions of thyroid, okay, where the weight falls down, there is no proper weight gain. So in those people, they will always have phobias or they will always have insecurities. Body को लेकर बहुत insecurity होती है, weight ज्यादा है, weight कम है, कुछ physical features ऐसे हैं जो कम है, ज्यादा है, like females who have small breast size or who have big breast size, who have small buttocks or who have big buttocks. So ये सारी चीजें body image और self esteem में आते हैं, those who have body image distortion condition. So for those people, they have to make sure that they have to learn to appreciate what they have. Okay, and those things which cannot be changed. Okay, ऐसी जो चीजें हैं उनके लिए हमें ऑल्टरनेटिव ढूंढना है, और जो मेडिकल कंडीशंस है उसके लिए अगेन यू हैव टू गो एंड कंसल्ट सम डॉक्टर, टेक सम मेडिकल हेल्प एंड help in maintaining the normal thyroid levels as well as maintain good hormonal level, good lifestyle. Okay, next thing is you should learn to have a open communication. That is, even if you're going to doctor, अभी बहुत सारे पेशेंट्स ऐसे होते हैं जो डॉक्टर को भी सही चीजें नहीं बताते, या फिर जो सच है वो नहीं बताते. So that is not right. You should always talk appropriately and openly wherever it is required. Okay, only then the doctor can help you and everyone else can help you. Okay, next is about positive behavior. We have to always have to maintain a positive approach towards life. If there is obesity, if someone has obesity, he or she should not get demotivated and should not lose hope that he or she will not lose weight. You should always have a positive approach towards everything. Okay, now next is focus on internal attributes. Internal attributes are nothing but आपके खुद की जो capacity है. Okay, even if you are obese or even if you are lean, आपके खुद के कुछ एक strong, every person, हर किसी का अपना अपना एक strong approach होता है. That is, someone will be a good writer, someone will be a good orator, someone will be good in studies. Even if they are obese, they will be good in studies. So ये सारे आपके internal attributes है जो आपको एक जरिया देते हैं to continue in your life. Okay, so because of these strong attributes, you will never lose hope, you will never be demotivated. Fine, because that is your power. Now next is a very beautiful topic. I don't know how many of you have held इमोशनल इंटेलिजेंस. आपने जैसे आर्टिफिशियल इंटेलिजेंस सुना है, वैसे ही इमोशनल इंटेलिजेंस इज ऑल्सो ए न्यू टॉपिक ऑफ इन दिस प्रेजेंट एरा, वेयर people are doing a lot of research, lot of dynamics are coming up, lot of protocols are coming up in terms of emotional intelligence. Emotional intelligence is nothing but आप एक स्पेसिफिक इमोशन जो आपका है वो कैसे एक्सप्रेस करते हैं, किस तरीके से जताते हैं, और उसको कैसे रिएक्ट करते हैं, और किस सिचुएशन में आप रिएक्ट करते हैं. सो दैट इज इमोशनल इंटेलिजेंस, wherein you will it is nothing but how you modulate your emotional response in any kind of emotional scenario. Okay, so that is emotional intelligence. Now if you have to maintain a good emotional intelligence, now I'll give you an example wherein I got married in early in this year. Okay, so before my marriage, I it was a difficult time because my very dearest cousin, she was on ventilator. Okay, she was totally fine. Then she ended up directly into ICU and on ventilator, and we had no hopes. Doctor had no hopes from her because her condition was so worse. And then from that, I had to get married and shift to a new life. So that was a total turnover. Okay, already emotionally everyone was very low at home because of my cousin. And then again I had to shift to a new relation, a new responsibility. So the ability of that person to change from one emotional instance to another instance is nothing but your emotional intelligence. तो आप कितने बेहतर तरीके से उस सिचुएशन को हैंडल करते हैं, कैसे हैंडल करते हैं, कब हैंडल करते हैं, that is in simple words called as emotional intelligence. So in every situation, whenever there is hormonal surge, you will have anxiety, depression, then varied emotions. ठीक है, either you will be too low, either you will be too happy, or either you will be too angry. ठीक है, so ये सारी चीजों में you have to learn to maintain a good emotional intelligence. There is a lot of literature nowadays present on this. Many people are writing good books on this. Okay, so you can go and read it in more detail. It is a very vast topic, but we'll just cover up in a small gist. Okay, so the first thing here is foster self-awareness. Okay, so foster self-awareness matlab kya? You should be aware of your surrounding. Okay, if there is any situation coming on you, if there is any difficult time which is happening around you, आप पे कोई भी मुसीबत आ रही हो, you should be always aware of your self. ठीक है, how now see, I had a difficult time, but I know मेरी capabilities क्या है, that I can handle my family, I can convince them, I can make them understand, and I can handle my outside other responsibilities also. Okay, so that is my self awareness towards that situation. So that is why I know that I can manage the situation and bring everyone out of it. So that is fostering self awareness. Okay, next is teach emotional regulation. Now what we do, like being a teacher, our next responsibility is like towards our students. Okay, so when students come to us with fear of exam, with fear of failing, with inability to study properly, focus, okay, so how we teach them is, we first teach them how to understand your capability. Okay, so if there are 10 days left for the exam and if you have to cover 5 chapters, it is actually not possible to cover it properly. Fine. So what we do is, we teach them to study those topics which are their prime focus, or which are their what you can say, which are their strong part. Okay, so those topics which they like, or which they have interest, so those are their strong topics. Fine. So because of studying those strong topics, or studying their those topics which they like, they will have a positive approach towards giving exam. They will have that thing in their mind that at least we have studied those topics which are our stronger era, okay, or which have our stronger zone, or which have the majority chunk of portion coming in exam. So that is how we regulate someone's emotion. So similarly, you can regulate your emotion accordingly to the situation. Fine. This is just an example which I gave. Next is promote empathy. Empathy is nothing but you should appreciate everyone's emotions, okay, as well as your emotions also. Fine. तो आप side में जो box में देख रहे हैं, by now you all must have read it. Okay, so that is nothing but being emotionally intelligent. That is how beautifully you handle any kind of emotional situation, and how you handle it and when you handle it. That is nothing but emotional intelligence. Okay. If you all have interest, then we can have a different session on emotional intelligence, totally different session, wherein we can cover it more in deep. But as of now, this is what is emotional intelligence. Okay. And in the last, as Buddha says that uh, you should always remember the law of impermanence, which was stated by Buddha, wherein he said that no situation is permanent and everything is going to change. Okay. But if you don't want to embrace that change, or if you don't want to try, या फिर आप कोशिश नहीं करना चाहते to reach that change, then no one can help you. Okay. So that is all for today's session. And I think I will hand over again to Durga. Thank you all for listening to me.
Thank you, ma'am. It was really मतलब बहुत new experience था, बहुत new information थी to process. अगर आप किसी को question है तो please आप पूछ सकते हो. मैं आपको unmute का I hope दे चुकी हूँ. तो आप खुद को unmute कर सकते हो and you can ask question if you have any. Yeah, Ashwini Wagh, you can unmute yourself.
Hello, am I audible?
Yeah, you're
Yes,
audible.
you're audible.
Yeah, Rishali, thank you so much. This is really a wonderful session, and the PPTs were so good. Thanks for that. Actually, you arrange all things very, in a really good manner. But just a small question which I have, one of my friend which is facing a sexual seizures. Can you explain little bit about it if you knew something? That
Sorry?
what is the causes of sexual seizures?
Seizures. Okay, okay.
So I don't find the kind of satisfactory material to read out about it. So can you please explain in a brief?
Since when like she is experiencing that?
She said whenever she have intercourse with the partner, she faced that thing kind of.
Okay, fine,
And
fine.
when she met the doctor, she didn't get a satisfactory answer. So she also said that she don't want to go to the doctor because they're asking a lot of questions and all. But we people take her to counselor, and the people also suggested that you have to go to a good doctor, a gynecologist. But I personally didn't get that, and you are a neurosurgeon. That's why I'm going to ask that what is the thing and why it is going to happen.
Okay, fine. See, ideally, in our brain, there are very beautiful organs, which brain is actually a beautiful organ, but there are very small organs in our brain which control all these kind of emotions. Okay, or this kind of feelings. Fine. Let it be sexual pleasure, like let it be sexual desire, intimacy, everything. Fine. So once someone is exposed towards such experiences or sexual intimacy, how the brain perceives it, that is important. Okay. So the brain will perceive it either yes or no. So if it is yes, then it is fine. If it is no, then you have to rule down what are the factors for that. If it is clinical in the sense, if there is some issue with the, I don't know whether she has undergone test or no, or whether she has done any kind of investigation. If at all, if there is something which is coming from central origin, that is, if there is something present inside her limbic system, or if there is something present, some pathology is present in her brain, in simple terms, then we have to rule out that. Along with that, we have to also undergo a evaluation. Okay, which is called as mental evaluation, where we will check her detailed history, if at all there was any past instance, or if there is any baggage feeling, or if there is any baggage instance where she had a altered experience when, or or if it is because of any kind of PTSD, that also you have to rule out. So if a detailed history is provided, then that can help us to give her a proper kind of treatment. And trust me, it is nothing related to her gynec issue. So if someone is telling her to go to a gynecologist, I think she should not opt for going to a gynecologist. Rather than that, she should go to a listener, or go to a therapist, or go to anyone who will actually understand her condition in detail. And instead of making her feel her awkward, she should be comfortable in talking. Now, these seizures will happen because of spike in her emotions. Okay, so in every emotion or every situation, your brain will release certain kind of hormones or certain kind of neurotransmitters. So if the activity of those neurotransmitters increases too much, then there is seizures. Fine. So understanding why that is happening is her case for us. So if you can provide me more details later after this session, then we can help her in getting some kind of alternative treatment.
Thank you so much, Vaishali. I'll be contact you, sure.
Yeah.
Thank you.
Thank you.
और कोई किसी को क्वेश्चन पूछना है? कोई कंफ्यूजन, समथिंग लाइक दैट? ऑलरेडी बहुत टाइम हो चुका है, आई नो दैट.
Yeah, it is 9 o'clock.
हाँ, तो अगर किसी को क्वेश्चन नहीं तो देन वी कैन क्लोज हियर. आई थिंक it was really good, मतलब informative session, like each and everything was new. और मैं खुद को भी इमेजिन कर रही थी थ्रू आउट द पूरा प्रोसेस कि क्या है क्या नहीं, इतने सारी चीजें मेरे बॉडी में और मुझे पता ही नहीं है. तो it was really good. और thank you so much ma'am for giving us इतना deep information, and I hope हम फिर से engage कर पाएंगे. और इवन इफ कोई मैम से बात करना चाहता है तो they can approach to ma'am. If ma'am, okay, if ma'am is comfortable with that. Minalta, you want to ask something?
Yes. So first of all, thank you so much, Dr. Vaishali, कि आपने काफी elaborate करके और काफी in detail जो information दी है. It was a very nice and thank you really so much. And मतलब ये था ना, कहीं तो ये जो पूरी like female as a journey ना, like मैंने ये काफी relate किया because and after the marriage ये cycle और ये सारी चीजें काफी ज्यादा हम फेस करते हैं. लाइक बिफोर मैरिज आई कैन इमेजिन एंड कुछ मतलब फील ही नहीं था, लाइक क्रैम्प्स एंड दैट्स ऑल वी फेस. एंड आफ्टरवर्ड्स बहुत ज्यादा हम ये सारी चीजें आई कैन रिलेट. ऐसा होता है कि लाइक ओवुलेशन के टाइम पे भी या पीएमएस है तो ये काफी मतलब कंटिन्यूअस प्रोसेस चलता रहता है, लाइक एंगर इशू या मूड स्विंग्स है. सो ये ना कहीं तो मतलब उसको रियलाइज करना कि भाई अभी टेक्निकली बॉडी में ये सब हो रहा है, लेकिन आप क्योंकि इमीडिएटली आप रिएक्ट करते हो, लाइक एंगर इशू है या मूड स्विंग्स है, ये सारी चीजें. सो आई फील कि आपने जो रेमेडीज बताई है वो एक कंटिन्यूअस ही प्रोसेस रखना पड़ेगा, जिसमें मेडिटेशन हो, योगा हो, या फिर सारी चीजें. बिकॉज थर्ड पर्सन को यू कांट एक्सप्लेन कि यार हाँ आई एम सफरिंग फ्रॉम दिस एंड सो आई एम रिएक्टिंग लाइक दिस. सो ये काफी एक स्ट्रगलिंग मोमेंट है फॉर ऑल वी गर्ल्स. एंड ऑल्सो आई वॉन्टेड टू लाइक आस्क इफ इट्स पॉसिबल देन, because you were talking about also the male and female brain. So can we have a session, like can you tell us in detail ki what are the basic differences, and like because as हम लोग भी काफी studies like करते हैं, like as a feminine जब equality की भी बात भी करते हैं, so like जब हम उस तरीके से बात करते हैं then एक बेसिक जो डिफरेंसेस है, सो वो भी अगर हमें पता चले, सो हम उसको और ज्यादा बेटर वे में कम्युनिकेट कर सकते हैं, आई गेस. हाँ, तो अगर हम ये बेसिक जो डिफरेंसेस है, लाइक उस डिफरेंसेस के साथ फिर हम उस इक्वालिटी की बात कर सकते हैं, बिकॉज हम सारे ही लाइक फेमिनिज्म और इक्वालिटी को मानते हैं। सो हमारी तरफ से भी कोई ऐसे चीज नहीं होना चाहिए कि भाई ये तो नेचुरल डिफरेंसेस हैं, देन अगेन वी आर टॉकिंग अबाउट लाइक कि ये नहीं, ये डिस्क्रिमिनेशन है। सो इस कॉन्टेक्स्ट में भी आई जस्ट वांटेड टू नो कि क्या ब्रेन वर्सेस भी क्या डिफरेंसेस है। एंड अगेन जो लास्ट में भी आपने जो इमोशनल इंटेलिजेंस की बात की, सो इमोशनल इंटेलिजेंस इन पर से इमोशनल मैनेजमेंट, ये काफी मेजर थिंग है। सो ये दो थोड़े मेरे एक्सपेक्टेशंस थे, अगर इफ इट्स पॉसिबल देन this will be very helpful. So
Sure, I think we can plan it some other day.
डेफिनेटली।
Thank you, ma'am. Thank you.
और किसी को क्वेश्चन पूछना है? There are some comments for you. So Ashwini is asking for your email ID.
Okay, I'll provide it. How, like, I should give it now, or
You can like, if you are comfortable, you can give here, like you can write over here. Otherwise, we can coordinate with Ashwini.
okay, I'll share it with you, then you can forward it.
Okay,
Fine.
Okay, I think then we can close here. Thank you so much everyone, लास्ट तक रहने के लिए और हाँ सुनने के लिए. Okay, तो स्नेहा, you have something? The earthquake theory, you talk about the example of seesaw that I think I am handling right now.
Okay.
So do you want to talk?
Okay.
Okay.
I am fine with anything. Like, if she wants me to answer now, I am fine with that. Or if she wants me to talk with her later, that also is fine.
So Sneha, you can unmute yourself.
Talk later. Okay. Fine, no problem. You just forward the details
Email.
and then I can talk.
Yeah. Okay, then.
Yeah, sorry to interrupt. And also, it would be very helpful if you can provide us a reading regarding this, so we can all like
Okay,
go through it
I'll
again,
share it.
like a basic readings regarding whatever you just told us today. So the theories and the major that the, because that was a audio clip, I guess, because we were able to see only the screen. So the meditation, what the two techniques you told us. So if you can provide us that material, so we can
Sure.
again go through.
Okay, I will share in the Sanghamitra group from after like ma'am के साथ coordinate करने के बाद. Okay, ma'am, thank you so much and thank you so much everyone for like यहाँ रहने के लिए. और आई होप जो मैंने पहले जो अनाउंसमेंट किया है वो सबको क्लियर है. और इवन इफ किसी को क्वेश्चन क्वेरी है, दे कैन जस्ट ड्रॉप मैसेज इन द संघमित्रा कलेक्टिव, देन वी कैन कोऑर्डिनेट. थैंक यू मैम once again and
thank you everyone. Thank you, Durga.
Thank you so much.
Thank you.